the Be Heard series. The point of this is to teach investigators, especially young investigators, the skills that are needed to increase the impact of the science that you do. These are skills that we aren't often taught. We've had, as an example, webinars on how to write an op-ed piece, how to work with communities, how to write a press release, how to write a commentary. And one of the important ways that you can increase the impact of your science is to get involved in your society. And one of the key things that societies do is writing position papers. This is a big job, but it's also a great opportunity to be heard and to increase the impact of your science. And I hope we convince you today that it also can be good for your career. We're fortunate today to have John Balmes as a moderator. John's an emeritus professor at UCSF, and he's been the physician representative to the California Air Resources Board, as he mentioned, for many years. This is an important policy-making organization. Most of the other board members are political appointments, and John has a unique perspective on policy as a result of this work. So, John, take it away. Thank you all for joining.
Thank you, Rob. And I'm a pulmonary critical care trained physician, even though I'm mostly doing research these days and not much clinical work. And it's interesting, the group that Rob organized here is connected by pulmonary health. I'm a longtime member of the American Thoracic Society, the professional scientific society for pulmonary critical care physicians and physician scientists like myself. And I'm happy to say that one of the speakers that you'll hear today, Meghan Rebuli from the University of North Carolina, I'm going to let her talk about herself. She's also a member of the American Thoracic Society, and that's actually how I know of her. And Vince Tedjasaputra is a senior staffer for the American Lung Association with regard to communication. He's also a scientist by training. And the American Lung Association and the American Thoracic Society used to be one organization. They're now distinct organizations, but still work closely together. And I have had the privilege of working with both ALA and ATS folks with regard to advocacy for public policy, especially in the environmental health arena. So I'm pleased to be moderating this session of Be Heard, which is to talk about how to write a white paper. And before I go into a little more about what we have in mind, I'm going to ask Meghan and Vince to each introduce themselves a little bit.
Thanks, John. I'm Meghan Rebuli. I'm an assistant professor at the University of North Carolina at Chapel Hill. And like John mentioned, I've gotten to know him through the American Thoracic Society. And I think my work through the American Thoracic Society was why Rob tapped me for this particular webinar. We put together a white paper or a workshop report in the case of the American Thoracic Society on the E-Valley or e-cigarette or vaping associated lung injury epidemic in 2021. And that was kind of a splashy piece that got information about the transition through this epidemic to the public and to the American Thoracic Society members. I'm involved in the Environmental and Occupational Population Health Assembly within the American Thoracic Society. I'm currently the planning chair for that society. And I'm also been involved in some of the early career working groups. And so I'm really excited that early career folks are the major focus for this particular webinar series, and providing information to help advance careers and overall be heard. So I'm really happy to be here. Thanks, Rob, for the invitation, and John for moderating, and Vince for coming.
Yeah, thanks so much for having me. I'm Vince Tedjasaputra. I spent 15 years in research. I studied how the heart and lungs work together during exercise, or not, as is the case in COPD and other chronic lung diseases. After I finished my postdoc at UC San Diego, I actually went to the AAAS Science and Tech Policy Fellowship in Washington, D.C., because I was interested in moving into science communication. So I spent a couple of years at the National Science Foundation in the Office of Legislative and Public Affairs. And mostly because I was tired of talking about lung disease. And then COVID hit, and so all we did was talk about lung disease. So, in my time training as a science policy and communications, learning about what's happening in the world and what we're talking about on the Hill or in the White House, and how it pertains to our work as researchers, as clinicians. Now at the American Lung Association, I'm here as me, and I don't represent them, but I'm happy to talk about the work that we do there. My job is my job is to be a translator, and part of it is a technical translator. So the research that you put out and the advances of knowledge that you put out, I help translate that into blogs, into videos, into infographics. But the other side of it, I think, that is probably more important, is I'm a cultural translator. And I think that's an important part of what we're doing today is, the old school mentorship model was that you get in the lab and write another white paper, or write another first author paper, and don't worry about everything else that's happening outside, or what's in the news, or get off of Twitter. But the world has changed a lot. And so our collective voices and being heard is as important as being listened to, right? So, it's a privilege for me to speak to early career researchers, to be inspired to realize that their voice does matter, and it's a voice of authority. But at the end of the day, when we come home, we're husbands, we're wives, we're partners, we're brothers and sisters and neighbors. And so it's important to understand what the link is between the work that we do, and the role that we play in society.
Thanks, Vince and Megan. So I'll talk a little bit about myself. In addition to mentioning that I was a pulmonary critical care doc by training, I also do occupational environmental medicine. And my research has mostly been with regard to occupational and environmental exposures that lead to lung disease. Then I added some cardiovascular outcomes. And then more recently, as Rob knows, I've been studying metabolic outcomes in kids related to air pollution exposure. And I do international work as well as work in the US. I've been very involved in household air pollution health effects in initially Guatemala, then Malawi, a little bit in Nepal, and now currently in Rwanda. So I do a lot of research, but I have this policy hat at the Air Resources Board. And I've been on the Air Resources Board since 2008. So I've been through a number of important public policy debates about how to address climate change mitigation and improve air quality. And I'm approached by stakeholders on there's at least two sides of every issue. There's the regulated community that doesn't want more regulation. And then there's the advocacy community, which the American Lung Association and the American Thoracic Society are usually part of, that want as much regulation as possible to protect public health and the climate. So I'm going to start off by talking about different types of white papers. But I guess even before I do that, at a macro level, and jumping off from what Vince just said so eloquently, we really want you to think about how your science can make a difference. I was interviewed yesterday by an academic who's doing an ethnography of children's environmental health. And, she was asking me what are the two most important things I'm concerned about in that context. And of course, I said climate change. But then I said, I'm really deeply disturbed about the anti-science. I don't know what movement may be the wrong word, but the anti-science flavor of much of our social discourse in the U.S. now. As a scientist, I feel it's important for us to get our message out. It's not good enough just to say that do good work in the lab and have it published in even a top journal like Science or Nature or the New England Journal of Medicine or Lancet. It's got to get out in a way that the public can feel that the science makes a difference. I've also learned from public testimony over many years at the Air Resources Board that physicians and scientists, and it's also other healthcare workers, aside from physicians, if they present their work in a compelling way, so it doesn't sound like a bunch of gobbledygook and it's not couched in a lot of caveats, it can really make a difference. The Air Resources Board is an evidence-based regulatory agency. So I always appreciate, whether it's in person or over Zoom public testimony or a white paper, which we're going to talk about today, that cogently summarizes the key concepts or findings that are relevant to the particular regulatory policy that's being considered. Okay, so I'm supposed to start off by talking about different types of white papers. And it's actually interesting that this series has already talked about how to write an op-ed, how to write a commentary, because those are both kind of similar to white papers. And I've a lot of experience with both. But, Rob mentioned society documents. And, Meghan is going to talk about her experience with a specific one. I'm such an old guy on the ATS that I've been chair of several writing committees that wrote ATS statements or workshop reports. I've just finished being on two that are, one that just got completed and the other one that's near completion. And I'm also an associate editor of our flagship journal, the American Journal of Respiratory and Critical Care Medicine. And so I have to, I see commentaries and perspectives and sometimes write them, editorials. And it turns out that some of the most highly cited documents in our journal are the workshop reports and statements, society statements. Again, one of which Meghan is going to share with you. So I can only speak directly in terms of my experience with the American Thoracic Society statements, but they are a lot of work, but you're working as part of a committee, and that network can help you advance your career, because over the 2 years that it often takes to put one of these statements together, you sort of bond with those folks, and that can lead to future collaborations, and then you can feel really good about the result because it's often highly cited and impactful. The most cited paper that I have in my CV of over 400 papers is an ATS statement that I chaired the writing committee of on occupational asthma and occupational COPD back in the late 90s. I also want to mention something about the Lung Association. There's a state of the art report. State of the air. I always say that. Vince, forgive me, State of the Air report that is literally the most cited document when people are writing grants or papers about the health effects of air pollution in the US. It's a highly organized and well-oiled enterprise, and I've had the pleasure of being involved with sort of not writing but editing in a serious way the health section of the State of the Air report. The State of the Air report describes, its main point is to show what air pollution levels are around the country, and for major metropolitan areas around the country. But there's a health section, and one thing that about both the ATS and the ALA, when they do advocacy about clean air to improve air quality in the US, it's very evidence-based. So the Lung Association reaches out to me and probably other people to make sure that what they're saying in the State of the Air report about health is scientifically correct. So that's so both the ATS statements that and workshop reports that I've been involved in, and the State of the Air report that I've been involved with the Lung Association are examples of white papers. And before I turn the mic over to Meghan, who I'll go with first, I also want to say I get white papers all the time, sometimes from the ALA or the ATS in my role as California Air Resources Board member, physician member. And one thing, aside from them being very valuable, if they're coming from an organization, or better yet, a coalition of organizations that I respect, is they have to be written well, meaning concise, to the point. Bullet points often really help. I think I said when we had the sort of a pre-talk about this session to Vince and Meghan and Rob that, if it's more than 5 pages, it's too long for that policy type of advocacy. In a different context, like the ATS statements, the ALA State of the Air report, they can be longer. But if you're trying to write a white paper to influence policymakers, legislators, executive branch folks, they need to be shorter and to the point, because often the principal person, the legislator or the head of the executive branch office that you're writing to, they're not going to read it directly anyway. It's going to be a staff person. And the staff person is looking at a lot of different white paper type statements, and they're going to digest it for their boss. So I've been talking a long time here. I'm going to stop because I want to give Meghan and Vince a chance to speak before we open it up to everybody else. And by the way, I think it's okay if people interrupt any of us. I should have said that before I went on and on with a question or a concept. I know Meghan and Vince can handle being interrupted and probably encourage it. And when you do speak, which we encourage you to do, this is a safe space. You can say anything you want. Ask any question you want. Please identify yourselves, because we don't know you. And you could say one line about why you're here too. Thanks. And I'm going to start with Meghan.
Thanks, John. So it's a great overview of some of the options for white paper statements and some of the ways that they've been used really critically. I shared in the chat a link to kind of all of the ATS statements that have happened so far, and then the link that has all of the information on how to develop these kinds of documents. And so some of that practical advice from those examples, as well as the documentation on how to put them together, was super useful when I started the process. So I shared them there. I also linked in the white paper that I worked on if you wanted a very recent example of what that looks like. But what I've been asked to kind of cover are some of the ways that I prepared for conducting this white paper, some of the skills that I learned along the way, and some of maybe the pros and cons of putting these together as a young faculty member, and what I've gotten benefits wise out of it. So just as some kind of broad perspective on what you need. So a white paper, especially in the ATS context, is really a collaborative effort across a multitude of experts in whichever field that you're working in. And so for me, as a very young faculty member, this seemed like a very intimidating thing to email all of these giants in the field of e-cigarette work, which is the theme of the white paper that I worked on, without any kind of context. And so to kind of build myself up for this process, I first got involved in the assembly of the society where I was working. And so that was me getting involved in the early career working group. And that gave me an in with a bunch of early career folks who were kind of working towards the same goals. And this was a very fortuitous event because I got to know 3 other early career folks who were very passionate about this topic. And we actually tag teamed this white paper, which I highly recommend doing. And so it was a team of individuals who had a variety of expertise and a diversity of experience. And I think that diversity reflected really nicely in how this white paper came together. So it was a team of 2 PhD trained scientists who had a very good grasp of kind of the basic and translational aspects. And then we teamed up with 2 clinician scientists who were working in the field, seeing these patients who are having EVALI and who are using e-cigarettes and had experience with working with these individuals. And so together, we kind of had a broader network, and we were able to feel comfortable reaching out to a broader range of the experts in this field. And I think that was a huge benefit. Writing up proposals for these white papers is also quite a laborious task. And so we could split up the work, which was really nice. And so the process, you propose the white paper. And so you write out an outline of what you're going to cover, which key question areas that you're going to answer. For us, it was mostly centered around what the current gaps are in the literature and what we need to know to really tackle this EVALI event and to make sure that this never happens again. And to make sure that people are protected in terms of their use of e-cigarettes. And so that happens about a year in advance of when you start working on it. You put all these documents together, you submit them to the society. The society reviews them and makes sure that it's within the society's purview as well as of interest to the society members. And then you get the go-ahead, and they give you a little bit of money to do meetings or to do phone calls or to do whatever it is that you need to do to put this together. And then the hard work really begins. This is when you contact and coordinate all of the experts in the field. And for our particular paper, it was 25 different individuals all across the world that we had to pull together to orient ourselves to where the current status of the field was. Required us putting together a set of webinars where we could talk and present data and come to consensus on a variety of items. This was quite unusual when we started this because prior to this, all of these events happened in person right before the American Thoracic Society annual meeting. But ours, unfortunately, was during COVID. And so we had to be creative and come up with alternatives. And I'd say that doing it in a structured webinar format in 4 different sessions was actually a lot nicer than trying to coordinate 25 individuals to show up at the same time in the same place for an 8-hour span. So we could kind of break that up. Once that's conducted, then the 4 of us chairs got together and divided out writing tasks to put this all together. So we summarized the different webinars, we summarized the talking points, we summarized the big questions that were still open-ended, made sure that we had consensus on our different research topics that we wanted to cover. And then we spent about 3 months putting the actual work in to write the report. And so that was a really interesting time. And I hope that from that description, you understand that it is quite a laborious and time-consuming task. But I will say that I think it was really worth it. I got to interact with and talk with and debate back and forth with the greats in my field, and got my name out there as someone that is, up and coming in this area. And now people like John Balmes know who I am, which is kind of incredible. But I also got to build collaborations with people and build broad experiences with other early career folks that, I think me and my 4 co-chairs, Alex Noel, Dan Croft, and Jason Rose, will all kind of continue to be friends and throughout our time in our careers. And so building friendships was another thing that came out of this. But I think the networking and the getting to know people in the field who are, highly respected researchers, was a huge benefit for me as an early career person who eventually will go up for tenure and will need letters and will need recommendations from people. And it was just a great way to get to know everyone in the field, and put my stamp on, I'm working in this area, and I, am someone who maybe people will look to in the future for expertise in this field. So I'll stop there and see if that was what John had in mind for me to cover.
Well, that was great, Megan. And you dovetailed with some of the things that I said about networking and how much work it is. And I'm glad that you mentioned, as a junior faculty person, that you have to be careful about the extra work you take on.
Mhm.
And I would just say that I just finished being co-chair. Again, it was a team effort of an ATS statement on research gaps with regard to health effects of household air pollution. And the junior faculty person, and she's a little more senior than you, who was sort of the lead person of our team, couldn't believe how much work was involved in getting it through the process. So we don't want you to be discouraged about doing that work, because as Megan said, the payoffs can be great. And I think Megan precisely captured the payoff. She's now a real person in the ATS. No, because it's a big organization. Now she's on a leadership pathway in the American Thoracic Society, and in a large part due to her work on that statement. So Vince is going to talk about his work on the ALA regarding white paper.
It might be really interesting, and I was just kind of thinking of this transition as we were going, so feel free to redirect, John. But I mean, maybe it would be good to hear about, after you get it out and you get it published, what happens next? Like, how do you get it to the public? And I mean, we posted it on Twitter, and that was probably the bare minimum of what we should have been doing. But I think Vince, when we chatted earlier, had some great ideas about how to really get it out to a bigger audience and to have a broader impact.
Yeah, thank you, Megan, for that segue. I was pretty sure Vince was going to go there, but
Yeah,
no, it's
thanks.
good. It's good. Vince,
Yeah,
take it away.
I'll share in my comments here. I'll share like 2 main themes. The first is how you can signal boost your work, whether it's a white paper or your own research, and also some communications principles that were really not taught in graduate school or graduate training or beyond, how to write for a non-scientific audience necessarily. So from the perspective of the ALA, like, look, give just greater context. We gave out $13.6 million last year in research grants. That's nothing compared to NHLBI's $4.4 billion, right? So, but what we do have is we have like this community aspect that's really not replicated, can't be replicated at the governmental level. And so part of my job there as director of scientific communications is to reach out to people like yourselves who publish papers and have been funded by us to publish those papers, and really try and signal boost that. And so it's interesting because it requires like a 30,000-foot view of what's happening, right? So in the instance of these white papers that we put out, so I think I I copy pasted the link to our State of the Air report. It's one of 3 of our signature reports. We have the State of the Air. And it's sort of a play on words because it's like, State of the Union, but also like it breaks down what the pollution levels and control those pollution levels are state by state. And so that makes it very popular with congressional staff. We publish a state of lung cancer, which looks at the lung cancer rates of like early detection or survival rates. We also do the state of tobacco control, which looks at the varying levels of state involvement in controlling tobacco from a policy perspective. So these are our 3 signature reports. They come out in different times of the year. And for us, we want to ride the wave of national conversation. So the most recent one that we published was the state of tobacco control. I'm going to copy and paste it in the chat here. And so, when we create a white paper and we get it out there, like we have a relationship with media outlets. We can post a press release to PR Newswire, and different news organizations like Reuters or Associated Press can pick them up. But we also do a lot of internal work before we get to that point to make sure that the messaging is on point. And this will segue later to messaging and communications principles. But once the report is written, and we have our experts like Dr. Balmes write and vet the information, we figure out what is, and I like to use it, what is the sexiest piece of data that we can use to get a really compelling message to our audience. And in this case, like the Biden administration has been sitting on these menthol ban rules, these rules to ban menthol cigarettes. And so there's a number of reasons why that might be, but we use the publishing of the State of Tobacco Control to shine a light on that. And so the biggest thing was that we use the publication to kind of pressure the administration to finalize and publish those rules banning menthol cigarettes, especially because they are, would be a big advance to health disparities, especially for African Americans, for the Black community, and tobacco control. So, like on the whole, that's how a paper goes from, just being words on a page to conversation topics in the news and hopefully at the dinner table. Nobody sits around dinner tables and chats anymore, but so that's a sort of high level perspective. And I sort of talked about, I look for researchers that we funded. If you have a paper that you published, I mean, we want to know about it if we funded you, especially. But what we do is we support the researchers that we fund by giving the media support. So if we funded you on a vaping study and NBC News calls you and wants to know about it, and you've never talked to a news person before, we can provide staff member to help prep you for questions, really boil down what the salient talking points are, what to say, what not to say. We can prep like infographics and sound bites. We can get quotes. These are the kinds of things that NIH can't do, right? Like, and so we try and find the research studies that are relevant and align with our priorities, advocacy priorities, and educational priorities as an organization. And so it's really useful because it gets a lot of eyes on. I mentioned in an earlier call that there is a benefit to your own career to getting your work out there, not just a white paper. Let me see. This is from the Annals of Thoracic Surgery. Paste it here. This is a paper literally showing that comparing if you tweeted your paper or not tweet your paper, what happens to your altmetric score. And it's like 9 times the amount of citations on a paper on average. And it seems a little bit silly, but like I'm gonna try and convince scientists with data that tweeting your paper does matter. So I'm gonna pivot a little bit to like basic communications, well, not basic communications principles, like scientific communications principles. Meghan alluded to, the work of the writing, like we're used to the back and forth between co-authors is usually only like 2 of your co-authors in writing a paper, and we're taught to write very specifically in the background and finding what the gap is and how your research question will answer that. But when you're writing for an audience, like an executive audience, for example, or a lawmaker, you sort of have to imagine that they're sitting on a train commuting into work and they have 50 of these papers in their lap, and that they may not get through more than 2 or 3 lines of your paper. And so that means that you have to get the words out very fast at the very beginning. And it's really uncomfortable for us because we usually spend at least a couple of pages building this tension in what the story is, and boom, my question is going to answer this scientific or medical problem. But in the case of these white papers, when you're suggesting a policy initiative or a policy change that could benefit the problem, you start right at the beginning. And so I'm saying that the first rule of writing, a white paper is, or anything really, is to know your audience. So you don't just write a white paper to write a white paper, and we just say like, oh, it's been published, you can read it. Like, no, we really have to focus on putting those words on paper and putting that paper in the hands of people we want it to read. And so we have to know what they want to hear and how they want to hear it. And so sometimes a white paper is 5 pages, sometimes it's 20 pages, sometimes it's an infographic that you post on social media. And so some of you might cringe at that thought, but there's a little bit of this ivory tower culture that we have to step back and admit that exists and step away from it. So for example, like, if a paper shows that 48.7% of youth who vape experience respiratory symptoms, and I think it's pretty close to what the number is, I would take that and put it in an infographic, and I'm going to say almost half, because for the audiences that we're trying to touch, that's way more impactful than a 3-digit number. And so part of my job is to make it look nice and put white space around it, like a design part. But the other part is to ensure that the scientists understand that there's a little bit of squish that we have to be comfortable with to get a really poignant point across. And so, I encourage you, when you're thinking about, is this worthwhile to write a paper on? Is it worthwhile to shout it out? Is it interesting enough? Now, we're scientists, but we're also human beings. So what makes something so interesting that you stop your scroll in an Instagram feed and actually read the caption? That's like a very basic thing, right? Or when you're at a scientific conference, which is supposed to be the highest level of expert to expert communication, what actually makes you pay attention and ask a question instead of checking your email, right? Because we've been to many of those talks where it's a PowerPoint slide that is, it's the blue background and in the yellow text, and it's in like 12-point font. What makes you pay attention to that? And so those types of empathy bits will help you write or craft your message to be easier to consume and get your message across more effectively to your audience.
Thanks, Vince. And I think at this point, I'd like to see if there's any questions or comments from our participants. We've been talking at you for a while, and now we'd like to hear what you think.
Hi, everyone. This is Carly Hyland. John, you do know me, but I'll still introduce myself. Assistant professor at Berkeley, and also with Rob McConnell, actually run a fellowship where we're trying to, increase research translation for early career researchers. So really, really appreciate this webinar. One of the questions I have, both for myself and also kind of other, early career people in the fellowship and in the field in general, is it seems like some of the white papers that you've talked about so far have been pretty centered around an organization such as ATS. I'm curious if you can speak a little bit to how common that is, if you have any, practice writing white papers outside of, I guess, both the support and also structure of an organization. It seems like that could result in both pros and cons. Maybe it would be a little bit faster, but also it is probably going to have a lot more, impact if it's with an organization, but some of us, don't yet quite have those really close ties. So yeah, just wondering if you can speak to that a little bit.
Do either Meghan or Vince want to take that on? Carly is somebody I've worked with for many years and still am working with. So she can always talk to me, but she can't always talk to you guys.
Well, I'm curious how this I'm going to interpret your question to be like the single person white paper, right? The single author white paper. And my first thought is, can that be couched under a commentary in a blue journal? Where the first audience is, hey, here's a potentially controversial, a hot take in pulmonary medicine that I want my peers to weigh in on. And like I've taken part of the point counterpoint series that the Journal of Applied Physiology does, and sometimes it goes off the rails, but it's kind of fun in a way that it sparks a conversation. And so, like, to me, that would be one way to do it, if particularly if it's like a very specialized topic.
Yeah, so for me, the other kind of white paper-ish kind of things that I've done that are more non-society based have been commentaries or editorial like articles that I've submitted for different publications. And so I was trying to find one really quickly that I had done pretty recently, but I published it through the Society of Toxicology journal, which is Toxicological Sciences, and it's a really unique kind of style of article that they publish, which is the article is published and then the community is asked to comment and have a conversation kind of underneath it on the website. And so it's more conversation generating. I think the biggest challenge with non-society based white papers is finding a place to publish it and finding the correct place to kind of elevate it and show support for it and get it out there. Because with the society journals and stuff that's kind of been signed off by these large groups, they get a lot of press, they get pushed by the society, they get pushed by other bigger organizations. They have some weight behind it in terms of name recognition by the society. But if you're trying to get something off the ground more alone, then you have to be careful about where you put it and who you pitch it to in order to get it out there and into the public. And something that I think helps with that is working with your university media audience whenever you're thinking about publishing it. If you get it into a journal that's pretty decent, your university media office has lots of resources to help with press releases. They can help you craft tweets. They can help you craft graphics or things that you want to push with your particular article to help get it in front of more people. Because it doesn't have that big weight of a society behind it to help push it forward. So yeah, I don't have a ton of experience with that, but I've done a couple of editorial and commentary pieces that are white paper leaning.
And Carly, I'll give you two examples that I think are somewhat relevant to your own position now. I wrote two white papers with help from close colleagues to try to get increased funding for two different programs. So I wrote these white papers at different times. One was a history of the California Centers for Occupational Environmental Health, because we hadn't had any increase in funding for those centers for over 20 years. And so I was trying to make a pitch to initially University of California Office of the President, and later legislators. And then I sort of did the same thing for the UC Berkeley UCSF Joint Medical Program that I used to run. And we weren't entirely successful with either effort, but writing those white papers, showing the strengths, challenges and opportunities of both programs, which I think are highly important programs and should be supported by the state as much as possible. Even if they weren't entirely successful at getting more funding, they were sort of successful in terms of getting people to work together to understand what we were really about. It built, morale's not quite the, right word, but it built sort of an esprit de corps, that we were all in this together, and we found other ways to keep the programs going. So yeah, I can talk more about that with you at another time. But you can, and I got help, from in particular the School of Public Health at Berkeley.
Awesome. Thanks so much. That's really helpful.
So it looks like Michelle had a comment in the chat. Do either John or Vince want to elaborate a little more on that for the broader group? About who your audience is for white papers, and specifically whether you're making them for an agency or multi-level audiences.
Yeah, I'll start and then pass to Vince. Yeah, we specifically wanted to mention, and so thank you, Michelle, for bringing it out, that what kind of white paper you write depends on your audience. And, we've implied the different audiences in our comments, but, to be specific, I just mentioned trying to get more money out of the system-wide organization at University of California, and then the legislature. That's sort of one audience. My organization, the California Resources Board, is part of the executive branch in California, part of Cal EPA, and we do public policy in public. We have a very transparent process, and so white papers are like key. I get white papers all the time from different stakeholders, from the Lung Association, in a coalition with the Union of Concerned Scientists, in a coalition also with the Natural Resources Defense Council and the Environmental Defense Fund. So the advocates often write something together because it's more powerful than just having something from the Lung Association alone. And on the other side, the regulated community, it's often something like the Western States Petroleum Association that represents oil and gas companies. So there, I'm the audience as a policymaker, and it's not just me, it's of course the other board members and the senior staff of the organization. I've been involved with efforts to get the California Department of Public Health to do something. So state agencies, local agencies, in the air pollution context that I'm often in, the Bay Area Air Quality Management District is the local district that deals with air quality and climate change issues right here in the 9 counties of the Bay Area. And I've also been involved with trying to get the Berkeley Planning Commission. I live in the city of Berkeley. Berkeley Planning Commission to, outlaw wood-burning fireplaces in new homes. And so, and then I've been involved in trying to educate the public about natural gas burning appliances, where I'm not actually trying to influence an agency. The agency's already trying to go where I want to go, both statewide and locally, but we need the public to come on board. So I'll stop there, but let Vince and Megan talk about other audiences that I haven't mentioned.
Yeah, so thanks for that question, Michelle. Defining an audience is sometimes like the hardest thing because it really, it's the next question that you answer after, the next question you ask after what is our goal? Who can do the thing that you want them to do? Or what is it that you want them to do? And so I think yesterday or 2 days ago, EPA just announced the new rules on PM2.5, dropping in
Yeah.
right? And it's a big win, and some people are saying it's not it's not restrictive enough, right? Like it's kind of an interesting thing. So I linked to the press release from EPA, and it's a good example that when you put stuff out there, people listen. Like these big agencies listen, because so if you have it open under the second example, so they list like, here are what's our community are saying. Under the second example is our senior vice president Paul Billings, who's a senior advisor for the vice president for advocacy, and he gives a quote and from a statement that we put out in response to this. So be sure that they are listening, and so much so that they highlighted it and showed a quote in their own press release. So
And could I just jump in
yeah,
before you go on? Hold your thoughts. So I was on the Clean Air Scientific Advisory Committee panel that, advised the EPA administrator about this new standard, as was one of my colleagues here at Pulmonary at UCSF, Neetha Thakur. And Neetha very smartly took the ATS blog about this win and sent it to our department chair, actually our division chief, and then onto the department chair, saying, 2 of your faculty were on this committee, and she wanted us to get sort of recognition within the organization, within UCSF for that. And that's why I'm jumping in, Vince. I didn't think to do that, but Neetha very smartly said, oh, this is not only do I feel good about what we did, but I can get some recognition for this within my organization. Sorry for that interruption. I just had to jump in.
That's like it's and that is strengthen the legitimacy of our voices when that happens. When your colleagues, not like when your colleagues sign on to a letter or a paper that you're on, but also to share this within our internal networks and even social media. So from like an actual what can you do perspective, in this specific example, they list all the people, all the other stakeholders who are interested in talking about this. And so say that you are writing a white paper saying that 9 is not low enough. You can go and see who's listening and who's talking, and you can go down in a rabbit hole and figure out how to get in contact with some of these people. Maybe that's your audience. Maybe Paul Billings is the person to take that point into consideration. So that's just an example of a way that you can chase it down. It's sort of the same way where, like, when I was trying to pick grad schools, I was looking at last authors and papers that I liked and emailing them cold because I knew those are the experts in that field. So.
And for our paper, at least, our group that we formed kind of decided who our major audiences were as we were working on this project. And so for us, it was kind of threefold in terms of who we wanted this to get to and who we wanted attention from. First and foremost, it was the NIH, to make sure that they were advocating or knew that we were advocating that we needed more funds and more focus in this particular area of research, and which particular things that we really wanted them to like put an RFA out for. So a couple of our foci were like long-term monitoring of people who had EVALI and were hospitalized for them to look at the progression over time. The second big audience for us was the CDC. We really wanted to make sure that they knew that keeping track nationally of these cases was still really important, and that just because the big bulk of cases had gone away, it didn't necessarily mean that the disease was gone. And having a national registry was really powerful in order to be able to keep track of vendors who were selling the products that were inducing this very powerful disease in these young folks. And then the third audience was researchers, to make sure that we were all kind of on the same page on where we thought the next steps needed to be taken in order to advance treatment and monitoring of this particular disease, and to help those folks that have been addicted to the use of e-cigarettes and what the options were to stop use to prevent this in the future. So those were our 3 audiences, and we kind of decided that these were the things that we wanted to target when we were setting up the white paper.
Thanks, Katie. Excuse me. I was just talking to Katie. Thank you, Megan. Anybody else want to make a comment or ask a question? We're running out of time, but we'd love to hear from you.
So I'll have one last question of Vince, and that's, you know, you had mentioned how the American Lung Association sometimes gets excited about a particular paper that's coming out and might leverage the resources of the organization to make it more widely known. Could you tell people a little bit about, you know, if somebody's doing something on respiratory environment and respiratory disease, they have a paper coming out that they think is important, what sort of timeline would you have? When should people contact you? How long does it take to organize it? You know, is this something you do, you know, a few days before it's posted by the journal, or is this something that you'd rather hear about 6 weeks in advance to give you a chance to think about it?
Yeah, so a specific example, we funded a researcher at Boston University who had a paper coming out about this longitudinal youth vaping study. We'd like to hear as soon as possible, ahead of the publication. So you know, what we did was we contacted them and the university's communications office, and also I forget which journal the paper came out in, but we contacted them as well to get a timeline on when is it dropping. So as soon as possible is better. Sometimes, most of the time, we don't hear about it until it shows up in the acknowledgements that they were funded by ALA. But if you think that there can be a splash made of this as soon as possible, and of course, like, we may delay it to time it with or right after some big event that's happening around that topic. If something crazy politically happens and it's eating up all the air in a room, we may wait a week to give it its own room, right? So some of those things we have to take in consideration, but to answer the question is as early as possible.
Good. So we're right at 11 o'clock. I'd like to thank John and Megan and Vince for this interesting session, and let you all know that you're on our mailing list. Our next Be Heard webinar is on March 8th at the same time, and it's about working with advocacy and community organizations. I think it's going to be quite interesting, so you'll get a flyer. Thank you all for joining.
I just want to thank Rob for organizing this, and Vince and Megan for doing a great job, and all the participants for hanging in there.
Thanks, everyone.
Well, thanks for having us. Take care.
Bye.
Bye-bye.